Thank you very much for the kind introduction, and to Louise and everyone on the steering committee for the invitation to come back the second time and talk a little bit more about value-based healthcare. As was mentioned, I'm wearing a number of different hats these days. It's easier to do when you don't have much hair. But today I really want to talk to you from the perspective of some of the work I've been involved with over the last year to try and build momentum around value-based healthcare in Canada. And in order to do that, I'm going to use a few slides and hopefully not get too bogged down in them. But I want to just, the areas I'd like to talk about this morning are, first of all, why this should matter to Canadians and specifically to patients. And I probably don't have to do that too emphatically with this group, but I will. I'm going to highlight, not in a lot of detail, but I'm going to highlight some of the Canadian initiatives in value-based healthcare that have been developing over the last few years. I want to talk a little bit about pharmaceuticals, innovative therapies in particular. And finally, as I'm sure everybody will be doing over the next 2 days, I want to talk about the need or the call to action for patient leadership to actually get this underway. We heard, and I think Scott did a great job this morning, talking about what patients can do or what we need patients to do in order to get the ball rolling. And I think that is the most important lens by far when it comes to the question of, why value-based healthcare should matter. But from a system level, and thinking about it as someone that's, I've worked in the public service in health policy for much of my life. I've also served as a Minister of Health. There are also some messages that you need to be giving elected leaders about, at a system level, about why this matters. And the first is, and I think this is something that's becoming better understood, but a real myth we've been living with in Canada for many years now as our health spending has grown is this notion that spending more money on the system will buy better performance. And I think most people in this room would know that, Canada is about the third highest per capita spender in the OECD countries. Our performance is about middle of the pack, whether you're looking at health status of the population, healthcare outcomes, or health system performance at the most. And why is this important? So it's important to recognize this, and a lot of people have talked about it, but it also means that the path that we're on, so as you'll all have heard more about the growing cost of healthcare and how that's a concern, potentially an opportunity cost for other areas like education and infrastructure. Every time we add more money to the pot to fund things the way that we've always done them, in many cases we are funding some innovative approaches, but they're not sticking. We're not leveraging the best of what we have developed in Canada, and we're not being as successful as we need to at scaling it up, spreading it across the whole health system, and making it stick. So if you add if you add $1 to the healthcare budget next year, and all you do is buy another unit of the same inefficiency that you had the year before, you haven't really accomplished much other than compound the existing challenges. So I think that's a message that patients can give a lot better than politicians. As you would know, another reason this matters is fragmented and poorly coordinated care is a big issue in Canada. I'm not saying that all of our care is fragmented, and I'm not saying that there are not good efforts out there at better integrating different sectors, particularly hospital and community-based care, but it's still what seems to bog us down. And whether you're a patient or a payer or a provider or a policymaker, you're still to a large extent dealing with silos when you want to go and talk to people about change. So as Scott explained, we can do a lot by grounding ourselves in patient outcomes to address that issue. In terms of the money, there's the efficiency side and sort of the compounding of inefficiency. But of course, every time we make those sort of investments, we limit our ability to offer new and innovative therapies because we're not creating more fiscal headroom, if you will, or we're not creating additional capacity to do new things because we're continuing to invest in the way we've always done things in the past. And that's particularly important in an area like pharmaceuticals or medical devices where, we not only need the opportunity to fund some of these things on a permanent basis, we need the money to be able to try them in the first place, to be able to generate the data and the patient feedback and all of the things that are really important to making a decision to make an ongoing commitment to something new. So bottom line, what's the call to action in my mind with Canada? And this is after, about 35 years in health policy, and most of that time, looking at budgets growing by 8 to 10%. We're well below that now in Canada. The call to action is really to do more with the same, not more of the same in the future. So what's been going on in value-based healthcare in Canada? How are leaders working to organize themselves in order to embed more of this in our system? So one of the great opportunities I had last year was to attend the ISHOM annual meeting in Washington. And with Andre's help and some other like-minded people, particularly Louise Binder, we organized a breakfast for all of the Canadian delegates. And we discovered that there were about 35 people. Many of these people had been coming to ISHOM for a few years. They were well versed in the principles and the methodology that Scott talked about, but they were having difficulty getting it going at home, getting these approaches in place. So with the support of a number of different sponsors, we, and under the leadership of the steering committee that you see here, and look at number 4 in particular, she should have been number 1. Really, in terms of the effort that went in. We put on a first ever Value-Based Healthcare Canada Summit last year at the Rotman School. Scott was one of our keynote speakers, and you can see, in agreeing to do this, and all of us listed here we're volunteering our time. We really focused on trying to get the most senior leaders, not only at the provincial level and from patient organizations, but to also get some of our pan-Canadian health organizations involved. So I understand Greg Webster is here or will be here from CFHI, the Canadian Foundation for Healthcare Improvement, Canada Health Infoway, CADIF. These organizations participated as well, and I'll come back to talking about how you might want to consider working with them in a minute. The summit itself focused a lot on the basic concepts and building on the offerings of people such as Scott. We really tried to ground ourselves in what are the basic principles, how does this work, getting clear to people what value-based healthcare is not. So it is not a cost containment mechanism. It's not a strategy to reduce budgets. And it is also, and I really like this, it is not an approach that is a top-down approach. So it is, unlike so many of the things we've done in Canada, it is not about blowing up and restructuring the entire healthcare system at once. It's really about working at a patient and clinician and community level, if you will, to improve outcomes. So all of the report covers I'm showing you, these are all publicly available on a number of websites, CFHI, Value-Based Healthcare Canada, and so on. So you can take a look. Another report that was produced by CFHI documented some of the value-based healthcare initiatives that people have been working on for a few years, probably without calling them value-based healthcare, but they incorporate many of the principles that Scott talked about. And I'm not going to go into them in detail here, but you can see, in terms of leadership, you've got Canada Health Infoway. What I've done here in brackets is I've cited the particular aspect of VBHC that the project is focused on. So, managing chronic disease through telehome care, that's a project that's associated with paying for an outcome or linking funding to a particular outcome, which is a big part of this. A social impact bond, which was issued by the Heart and Stroke Foundation. So this is where private funders offer an investment in order to support a particular societal outcome. In this case, it was focused on strategies to reduce and prevent hypertension among identified patient segments. The investors' return is dependent upon the success of the initiative. Medavie in New Brunswick, many of you will know Medavie, created a not-for-profit organization to build on their existing role in the healthcare system there with respect to home care and ambulance services. So there, again, that's another outcome-linked, in this case, procurement as opposed to payment. Government of Ontario has done a lot of work with bundled payments, which is something you'll see in their literature, and particularly this project, which is to do with hip and knee surgery. So again, bundling all of the funding that would come from the various inputs to deliver hip and knee surgery, everything from the prehab to the rehab and the surgery itself, and bundling that money and then paying providers based on the outcome that they achieve as opposed to paying for those inputs. Saskatchewan with their accountable care units, and the Ontario Diabetes Pilot, which a number of you may have heard about. These are all projects that are continuing, and you're welcome to look at the executive brief or to look for actual results as they're coming in. But that's a useful tool. So that's the report cover there. The third thing we did, and Andre was part of this, is with the help of CFHI, we put together a design day in August, and we asked ourselves, so if we were going to look at Canada or individual provinces or communities, what would be the criteria that we would use in order to select a worthy project? As you know, we're the land of pilot projects when it comes to health systems. So how would we actually make an intelligent selection, both in terms of the potential impact on outcomes of the project itself, its contribution to other priorities in the healthcare system, and its probability for success. So I'll talk about that in a moment. So that report is available as well. So you've seen some activity around bringing together senior leaders, educating people on the basic concepts, thinking about how to select good projects before a whole lot of money is invested, and then learning from some of the projects that are already in place. We've been supported in this work to a great extent by the World Economic Forum and the Boston Consulting Group. Andre has worked extensively with both organizations. They have produced some sort of foundational reports that he may be talking about either today or tomorrow. There's the Ontario Diabetes Pilot, which is one of the two global projects that the World Economic Forum is supporting. There's a guide that is in development, which Canada is participating in. It's you might think of it as a playbook, a detailed methodology that's meant to be usable by patients, as usable by patients as it is to subspecialists who are interested in this area, step by step, how to identify a patient segment, how to develop outcomes, how to collect data, and so on. And so that advice and support has been very, very helpful. So I'm not going to go through these last few slides because Andre is the expert on the approach and the methodology. But if I could, I want to leave you with a couple of thoughts. So one is, where can patient organizations have the most impact? I think, as Scott said, you're putting information out there, identifying particular outcomes that are important to patients, whether they be capability or comfort, or any of the things that he talked about this morning is really, really useful. And I think it will prompt people who are in positions to make things happen, to get more involved in this, and to not be jaded by the idea that this is not just another fad in healthcare. This is a way to build improvement from the ground up. So I really encourage you to become more involved in that. The other area where we've had a little bit of difficulty, I won't go backwards, but I listed the steering committee, and it has been somewhat difficult to engage clinicians in Canada in this discussion, at least insofar as our sort of budding organization has experienced. So we need more, we believe that all physicians, all clinicians in all disciplines want to see, obviously, better value in the form of better outcomes. They want to care for people, and they want to use resources to the best of their ability. We have to make it easy for them. We have to find a way to make it easy for clinical leaders to get involved in this. Yes, there are a whole bunch of, issues that have to be resolved. So, for example, the fee-for-service model that is predominant in Canada is problematic when you look at the notion of actually paying for an outcome as opposed to an episode or an interaction with a patient. And if I was standing here when I was 25, I would have said, well, we've got to go off and we have to solve that before we can even begin to think about value-based healthcare in Canada. Please don't take that view. There's a lot that can be done by starting from where we are, and I think if we get the leadership that we need from the patients, that we will get there. So I hope to have another report for you next year in terms of what we're doing with the steering committee. We're looking for a host organization so that we can, we can have some support in terms of getting a member database together, starting to post some resources, updates on some of the projects I talked to you about it. So we want to do that. We also want to see some projects launched. And I'm pleased to say that in Canada there's lots of interest, both among public payers and industry, in supporting this work. Louise has a fantastic idea, or a fantastic question about, has there been a patient-led value-based healthcare initiative anywhere in the world? I don't know the answer to that question, but we could sure do with one in Canada. So I'll leave it there. And thank you, and look forward to updating you and hopefully coming back next year with some more concrete examples of what's happening now, perhaps as a result of some of your initiative and your dedication. So thank you very much.